Okay, so let's move with the next talk. I think there's no need to introduce Professor Evangelos Liatsikos. You know that he's the chairman of the European School of Urology, the new chairman of the European School of Urology. And we have seen in the last 20 years, amazing new development in terms of endourology and mainly regarding flexible ureteroscopy. So now, Evangelos, you will tell us what we can expect more regarding single-use flexi URS.
Thank you, Olivier. So I will try, even though a lot of what I'm going to say is, we have a lot of talks and unavoidably there will be overlaps with other presentations, but the concept is to see why and what is the market for single-use flexible ureteroscopy nowadays. And we have always, all of us have been trained and have been developing our expertise with the reusable scopes. And we started many years ago by using reusable scopes that were fiber optic, and it was terrible, and we were struggling. And we would have never imagined that after not so many years, the development of the image and of the vision that we have right now would be so good. And this is clearly something that we all need to keep in mind, that if the development of the past 10 years has been so drastic, I don't even imagine how the development of the next 10 years will be in all this that we're discussing about. So as a starter, I would say that clearly the multi-use scopes are much more expensive. If they break, they're very costly. And we all know that we all have residents, we all have fellows, that if your fellow, if your nurse calls you and tells you that your fellow or your resident broke your scope, and this is a multi-use digital scope, you really go crazy, because it is a big expense, and it really means that you will have to spend a lot of money to get another one. Sterilization concept is a concept, clearly, especially, I would say, the world is not a common market. So we have the US, we have France, we have Germany, but we have also Eastern Europe, we have Asia, we have a lot of places that sterilization is not the #1 point, but cost is the #1 point. So the market, if you see it as a marketing perspective, clearly sterilization is something that is a very hot topic for certain countries, but not so much for other countries. So it's a balance of reusable scopes, cost and sterilization issues, and also this needs to be evaluated. When can a single-use scope be used? And we heard all the speakers, and we heard everyone discuss about it. Clearly, a scope can be used in all cases. There's no limitation for a single-use scope. Even better, that you can do more demanding cases, because if it breaks, it breaks, and the cost is low. Clearly, the big benefit for me is that with a single-use scopes, you will get a lot more people doing flexible ureteroscopy. A lot more people will learn how to do single-use. All my residents, for example, now are doing flexible ureteroscopy. Before, I admit that the residents were learning first PCNL, and then they were learning flexible ureteroscopy, because I could not afford to let them break a digital scope. So this is for me a key point for all this, because really, if they break a single-use scope, they broke a single-use scope, it costs you 800 euros, it costs you 600 euros, whatever, and that's it. And we can afford that. So for me, the biggest benefit of the single-use scopes is not sterilization, which is a big plus. Yes, I admit it. It is the widespread use to everyone, and it makes teaching easier for us, and it makes the spread of this technique much more efficient and fast. This is very important. If we go back to history, we all have to give credit to Boston Scientific that they started with this concept, because they were the first to start. They were criticized also in the beginning, But then, as life always does, there was competition appearing, and then the prices went down, and now we have reached a very nice level of very economically, acceptable presence of single-use scopes out there in the market. Many studies have been showing that, have been trying to compare the LithoView, which was, the first in the group, with the others, and clearly all the scopes became better and better and better. We saw scopes that were terrible, like the FlexorView, for example, in the beginning, but all that is good because it helps development. It helps develop competition between companies, really helps development of everything. And when there was clearly studies evaluating single-use and reusable scopes, because the first question was, what do I do now? How do I use a single-use or a reusable scope? It appeared clearly, and you don't need a lot of science to understand this, that at least for stones, we're not talking about tumors now, but for stones, the rates of the stone-free rates and the outcomes were the same. There's no reason why they shouldn't be the same exactly, and with no more complications. In fact, actually, one would think that with a single-use scope, you would do more demanding cases and you would have more complications, but it never showed out in the literature. Cost is a very important issue, especially for certain markets, including the market where I live and when I'm working. And we need also to keep in mind that even though it is a single-use scope, in real life, and we need to say these things, in real life, in certain countries, it is not used, the single-use scopes are not used as single-use scopes. This is why the companies also have limited their time, their lifetime. This is why you have a limited lifetime, because you would never do a flexible ureteroscopy for 4 hours. So why would a company limit the lifetime of the light? Because people use it for more time. So it is clear that cost is a major issue that drives this business. Major issues that drive this business. And clearly, if you compare the costs, there is no relation, especially in centers that are not high volume centers, there is no comparison. Private practice, the same. In private practice, a lot of doctors go and do cases that do not have experience with flexible ureteroscopy. And the rate of breaking a scope is so high that if we're reading in papers that in centers, in very well equipped centers, the breaking rate of a scope would be something like 60, 70, 8 cases per scope, per multi-use scope. In private practice, I don't know in your countries, but in my country, scopes used to break after 5 or 6 or 7 uses because people didn't know how to use them. So cost is a huge aspect. Now, technical details about the new 7.5, Guido showed them very nicely. The big advantage of this is that, in life, not everything goes according to one theory. So there are certain topics, size matters, but in this case, size matters in a contrary manner. So the smaller, the better. In this case, in life, not always the smaller, the better, but in this case, it is. Why? It is clear. It is clear because you can go and you adapt the instrument to the ureter. So in the future, I think that companies will try to go even smaller. And the vision and the chip technologies will probably allow them to do this. So the big novelty of reducing the scope size, which is something really important, is that you can respect more the anatomy by not decreasing the quality of the image and the irrigation. So I think this is very important. You can, once you are in, you don't realize that you have a smaller scope. I tried a couple of times to go in without a wire, and I must say that in men that have a big prostate and I have to lever, I had some problems. So I not always managed to go in without a wire. And in very narrow ureters, even over a wire, sometimes I've had an issue to push it up. But again, it's such a small device that most of the times it can go up over a wire. So I am a big fan of decreasing size. And I personally think that in the future, we will decrease size even more. So this is a beginner, this is the first step, but I'm sure that we will see more. We will see more of decreased sizes. We will see more of adapting new technology on single-use scopes, because as very well Olivier said, we have a couple of questions that when we're doing flexible ureteroscopy are not met. We don't have answers to what kind of pressures we're generating, and we don't have answers on what kind of temperatures we're generating. We have studies, we have bench studies, we have animal studies, we have clinical studies with ways that we are thinking of calculating the temperatures, but we don't have scopes yet that have pressure sensors and temperature sensors. And I know that probably this will come out on reusable scopes, and then it would justify the difference of cost of a scope like this. But my vision for the future would be to have a single-use scope that would give me features like this at a reasonable cost, because this, in reality, is the only problem of flexible ureteroscopy. What kind of damage you are creating potentially without even getting to know it. So clearly, there have been publications regarding this decreased size scope, and it seems that the results are comparable, and clearly the benefit is that you decrease the access sheath if you want to place an access sheath. So the size of the access sheath can be further decreased, meaning that you can really decrease the damage, the potential damage to the ureter, and or you don't need to pre-stent if you don't want. So this is a big advantage, and it doesn't take a lot to compare the two scopes with each other. You see visually there is a difference. So you also notice it with the eye that there is a difference. Most of the times when you're comparing such a small number of friends, diameters, you don't realize the difference. But in this case, it is clear that the 7.5 to the 9.2, you see the difference. There is no reduction in flexibility. So they have managed to decrease the size without decreasing the quality of the image, of the deflection, and of all the movements that you can do. So really, it's a scope that I think is going to pave the way, is going to create a pathway for further development, because everyone was moving ahead towards making the image better. So this scope really creates a pathway to decrease the size without decreasing the qualities of what you're getting. And again, it is a scope that allows you to move inside the kidney very nicely. So it doesn't decrease maneuverability at all. It gives you the possibility of being able to go in, move in all calyces, do everything that you used to do previously. And the image is more than acceptable, I would say, is fully comparable with the previous generation and all the other single-use scopes. And if you're not treating tumors and you're treating stones, because for tumors there is a debate, I would say that it's more than efficient to do a good stone clearance job, and irrigation is good and everything. So I think that the future of flexible ureteroscopy will clearly move to decreasing the size of a scope, and will make things much better. We will see in the next years, next couple of years, not so many, in the next couple of years, big developments, because this is a huge market and there's no discussion about it. The companies are investing in it, the doctors are giving their ideas, and this is how the whole thing is going to proceed. So having said this, concluding, I would say that clearly increased single-use ureteroscopes in the market in the future. I see this because this is a need, not only for sterilization reasons, but also for cost reasons and for educational reasons. The outcomes are the same, similar or the same. Clearly, the contamination is very important for some countries, and it satisfies the need there also, because no matter how well you sterilize your reusable scope, you will always have issues with that. And clearly, patients like pediatric population and anatomical deformations and anomalies, having a smaller scope is clearly a big benefit on all this. Thank you very much.
Thank you, Evangelos. Excellent talk regarding this new development. And I think that you clearly explained that we open a new door with single-use flexi ureteroscope. It's like for the rest of the disposables, finally. If you think about double G, we have multiple double G available today, not only one. Same for the baskets or for ureteral access sheet. And now it becomes the same with single use, that many companies are able to develop different endoscopes. Maybe, as you said, more sophisticated with sensors or things like that, but also maybe also more simple for simple case. We don't need to have such sophisticated instruments. So my question, Evangelos, for you, if you were looking for just a new improvement, something new that you really need today, would you discuss this sensor? Would you discuss even smaller size? Would you prefer to have a 3D picture, because we have no 3D today picture? What is your first need actually?
Well, the first need for stone treatment, as I said, I think that the first need clearly is to have some idea of what you're doing in the kidney when you're operating. We've gone backwards, I think, with flexible ureteroscopy. So we have used very advanced equipment without knowing what is being performed up there. And and flexible potentially can be very dangerous because people do not realize the danger. They go in, everyone can put a wire up the ureter. On a pre-stented ureter, any urologist can go up with a ureteroscope. This is the potential danger. Not everyone can do a PCNL because they are afraid. They have the fear. The danger is present in PCNL. So for me, it is very important that the scopes give us ideas and we standardize certain things regarding temperature and pressures. This is the first step for me. All the rest is huge development that we will need to see. 3D will make it much better because you will know exactly the angles. Yes, decreasing further the size would be very important because you can go in much easier and you will be able to work easier. But if you don't standardize what you're doing up there and you don't know what the effects are up there, then it makes it a big problem for me. And as I said, the fear for me is that this thing is booming now. A lot of people are doing it, and they need to know their limits. So the limits can only come after standardization, and standardization can only come if everyone, regardless if he's Traxer or Liatsikos or Sites or whoever, he knows when he's working that he's using this kind of pressure and this kind of temperature. And then when he has a complication, he can go down and check, what did I do wrong with this case? Why did I have it? I was using this and that. So objectively, there will be outcomes and studies regarding the potential risks and what we do in reality. So for me, the first point to develop is sensors.
Okay, I agree with you completely, Evangelos, and I think that you gave a very strong message regarding the safety. As you said, all the people are able to do flexible ureteroscopy, and especially now with these single-use instruments. They are small, so not very complicated to put into the kidney. And I would even say that now, since we're using more and more powerful laser units, not only holmium, but also these new thulium, they're super powerful. And I must say that I'm a little bit afraid when I see some people using this super powerful laser in different ways. So you're right, we need to know exactly what we are doing now in terms of pressure and temperature. This is probably the next step that we need actually in terms of development. Fully agree with you, Evangelos.